Is it important to have your lips flanged when you're breastfeeding or bottle feeding? That's a question I get all the time in my office. And my answer to that question is absolutely yes. My name is Joan Comrie. I'm a pediatric speech pathologist specializing in feeding and swallowing disorders in infants and children. So why is it so important to have your lips flanged? Well, first of all, what does a flanged lip mean? Flanged lips are when the lips flip like this, and it's important to flip all the way to the cap of the nipple. It's also important to flip when you're breastfeeding. And why is it so important? I tell moms one of the #1 things that you can do to increase success of breastfeeding and bottle feeding is to make sure those lips are flanged. Why? Well, first of all, I want you to tuck your lips under and feel what happens to your tongue. When those lips tuck under, your tongue retracts, and a retracted tongue is one of the worst positions that your baby's tongue can be for breastfeeding, in particular bottle feeding as well. And why is that? Well, when the tongue is retracted, the entire blade, which is what it's called the tongue blade. The entire tongue blade is not stimulated by the nipple, and it's also not going to be activated. You're only going to get to the anterior part of the tongue doing the work. That's not a very efficient pattern. So we know babies are resilient, and if one part of your body is not working very well, the other part of your body is going to kick in and do something. So if the tongue is not doing a great job of stripping the nipple and getting the milk, your jaw is going to start biting, and that's when you see babies doing a lot of biting. So if your baby is biting, especially if you're a breastfeeding mama and that baby is biting, you make sure you take the time to get those lip flanged. That's super important. That will increase significantly the success of your baby for breastfeeding, and it will reduce your stress. Only takes a couple seconds. I know it's super frustrating if baby's lips can't maintain that flange, even if you're doing it over and over again. You may need to see a specialist who can identify if your baby has a lip tie, and that can be taken care of by a specialist. When that tie is released, your baby will have more function, and the baby will be more successful maintaining that flanged lips, which then allows that tongue to become more forward in position and activate the entire tongue blade for successful breastfeeding or bottle feeding. I hope this tip was helpful. Again, please take a moment and like this video or subscribe or send it to a friend or a relative or anyone you know that might need some help or these tips for successful feeding of your infants. Thank you and have a great day.